Back pain is one of the most common health conditions affecting millions of people. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Kaipo Pao, interventional pain physician at the Queens Medical Center. Good morning, Dr. Pao. How are you doing this morning?
Good morning. Thank you for having me.
Now, first off, how common is lower back pain?
Yeah, low back pain is very common. It affects people of all ages. Up to 84% of the world's population will experience back pain in their lifetime, and 540 million are affected at any one time. In addition, 23% have chronic low back pain, and it is estimated that 11 to 12% are disabled from it. In the US, it's the second most common symptom for physician office visits and the most common pain problem reported by adults.
I know I experience that every morning, doctor, trying to get out of bed. Now, what is the course or progression of lower back pain?
Well, typically the course of low back pain has been seen as being benign and favorable. More specifically, during the first 4 weeks, if the pain has not gone away, there is a significant decrease in pain and disability. From 4 weeks to 3 months, improvement slows, but there's continued reduction in pain. By 1 year's time, the average level of pain and disability is minimal, if at all present. Unfortunately, even after recovering from an episode of low back pain, recurrence is common. So about a third will have a recurrence within 1 year. But on the bright side, more than 80% of the recurrent episodes are mild. But as we get older, unfortunately, there is more recurrent episodes, and these episodes tend to persist longer.
And lastly, and most importantly, how do you treat lower back pain?
Yeah, good question. So the first step is always conservative treatment. And initial conservative treatment involves really staying as active as possible and continuing or gradually resuming your normal levels of activity. If possible, you should remain at work. Studies have shown that seeing a physical therapist early on improves patient outcomes and decreases their need for surgery or injections. It also reduces physician office visits, use of medications, as well as use of MRI. If you are not able to do physical therapy, exercise in general is an important part of the rehabilitation process. Otherwise, medications would start with over-the-counter, non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or Aleve. And with this approach, about 50% of patients will recover completely in about 2 to 3 weeks. If after 6 weeks of conservative care, your low back pain is not improved, then that's where I might come in. So after I perform an evaluation, imaging could be obtained for consideration of injections for the pain. And these are usually cortisone injections or nerve blocks, and the injection needles are guided with X-ray or ultrasound to get the needle in the proper position.
Now, to learn more about the services being offered by the Queens Pain and Spine Center, visit www.queens.org, click on Services, then click on Pain and Spine Center, or you can give them a call at 808-691-5390. Thank you very much, Dr. Pao, for your time, and have a great day.
Thank you.